right, it's 6:01. Meeting of Scotland County Board of Health to order. We'll have our invocation by Diane.
Bow your heads, please. Let's pray. Heavenly Father, Lord, we are so grateful tonight for your grace and your mercy. Lord, we thank you so much for blessings, Lord. We ask that you look down on this committee, Lord, this board meeting, as we go about the business of Scotland County. And we ask, Lord, that you, as we deal with the issues of our people in Scotland County, Lord, we ask you that you work on us and help us stay alert as we go through this process. And we will give your name, Lord, all the honor and praise. Amen.
Amen. Is there any discussion about our agendas that were on the table for you and mailed to everyone prior to? All right. No discussion on our agenda. We'll have a motion to adopt our agenda.
So motion.
A second.
All right, moved in second. So we will move on. You received a copy of our December minutes in your packet also. Do I have a motion to approve the minutes, or are there any changes or corrections?
I'd like to offer a motion to adopt our minutes from last meeting.
Second.
All right, minutes have been approved. We'll now open up for public forum. If we have anyone in public forum, we just state that you please state your name and address and observe the 3-minute limit. All right, we have no public comments. So we'll move on to our administrative reports. We will have our fiscal update, fee schedule update from Tim Martin.
Good evening.
Good evening.
This is the 31st, 2024 packet, so you will have time to be. Scotland County Health Department expenditures out of January 31st, 2024 should be 7 months expended, which is 58% used in your last column. Do y'all have the? Okay. We are currently at 47.2% spent, so we're currently under budget. The only place I will draw your attention to is immunizations. Well, you see we're over expenditures there. However, the next sheet will show you how we have exceeded in revenues. So when that occurs, we have to make an adjustment with the county finance to put money back, reverse the revenues, over revenues back into the expenditures. I was about to say amen, but any questions? Okay, on your next slide or your next sheet will be the revenue collections. That should be at 58% collected. We are at 45% collected, so we're a little behind on collections, but also understand that the way our revenue works, we're always a month behind with our revenue, posting our revenues. Any questions? We'll draw your attention down to the bottom where it says PAVE and infant mortality, where you see nothing. The PAVE grant, we just received money for. We just got some checks in the mail, some revenue from that program. And the infant mortality will not start until November. So we're just now getting in revenues for those grants. Any questions? The next slide, we'll talk a little bit about our COVID funding. It's been a long 3 years, right? And it's now in FY24, all of it is going away, save one grant. So I did want to let you know and give you an update on where we are with these grants. The 543, which is basically anything for detection, which was any of the things for mask, Lysol, cleaning stuff, all that kind of things, other things that we did. So there's $107,000 left in there. When we take out the $83,000 that we just paid to complete the payment for the mobile unit. So, and then the 716, I'll skip down to that. There's also $124,000 there as well. Those programs, grants end May 31st. So we have to expend those funds by May 31st. Please note, once again, we do not receive these funds up front. We have to pay for them up front, and then we get reimbursed from through a reimbursement system. So. And the last one at 546, you'll see there the communicable disease recovery. That is the only one that is going through December of 24. That is the only one that's going to carry forward. As you can see, anything in blue is things that we have already got quoted for, or the prices that we have to spend some of that money on. Also, we have been in talks, and me and Miss Amanda have been in talks with Kim McCray at DSS. We're looking at, we currently had a water fountain in our area, and we replaced it with a touchless. You can fill up bottles and you have cups to fill. There's no more mouth to mouth on the water fountains. And we also, since DSS is located in the middle of our building, it is considered one of some of our facilities. So we're looking at changing out 2 of those water fountains they have to that as well. 3, excuse me. There's another water fountain that we have in the clinic that we're looking at changing as well. And those are around $6,000 a piece, the quote I looked at before. So that's about $18,000 to replace those water coolers, those water fountains. Also, you'll see on this CD, the things that also we have lab renovations. We've renovated our lab through some of those funds. And we are purchasing a shelter to cover our mobile unit when it gets ready to house in its permanent location, not permanent location, but temporary location to when we get to use it. The 716 vacation, let's go on vacation. Vaccination program. I did look up to go with our vaccination clinic out here. I did look up actually some A-frames that are digital that we could use to, when we are going out in the area with the mobile unit, we could have signage that would say where we were and everything. So those end up being about $5,000 a piece, which is about $10,000. The reason I'm giving you all this information is because we are coming before you as a finance and health director, asking you guys if you could assist us with how to spend, ideas of how to spend this money. As you can see, 107, 124, quite a bit of money. So we do seek the pleasure of the board if you have ideas. There are complications. There are restrictions on what we can use this money for. However, and we have used our resources and we've used our brains, but if there's someone else who can come up with some other ideas, it would be greatly appreciated. So we do ask the board if they can have it. I will tell you, majority of it has to be COVID related when it comes to, I can't buy $1,000 worth, $100,000 worth of mask and Lysol, but I can buy some. But there are other things that we might not have thought of that maybe you guys have thought of, as far as the other thing as well. So does anybody have any questions?
That was actually one of my questions, is how are we gonna spend the remainder of it? And I know we may have some ideas, but I know like one of the big things is, for me, is I don't want to just spend it frivolously, right?
Correct.
So what have some of the what are some of the other things that other people that, you know, the health department needs? Like, what is something that you know may be a need that we can, I mean, you can tie things to COVID funds, because I mean, COVID is an infectious disease and we're trying to prevent the spread of things, and COVID's not gonna disappear next winter, you know?
Exactly. I will say the Department of Public Health has kind of loosened some of the strings
Mhm.
on some of this money. I do know Miss Amanda has asked for several different things to be done, and they've approved whatever she has requested within within reason to all those things, which is including the mobile unit, which we also have a communicable disease response vehicle. We have the breezeway over the health department now. We have several different things that we were able to use that money for.
So
Yes, ma'am.
another question. So, I know we had the ribbon cutting for our mobile unit, right?
It's gonna be next week.
It's next week. Okay. So I toured the mobile unit, right? It is it's nice, right? It's good for like outreach things.
Mhm.
But I know I spoke with Amanda because there are some things within that mobile unit that make it not practical for use
Yes.
for things that our community would need. We would want a mobile unit where you could take it out and do, uh, like sports physicals.
Mhm.
Like if we could offer free like how many kids can't get to the clinics to get their physicals? I know for a pediatrician, I do many. That mobile unit we have currently does not accommodate for sports physicals or any physical exam for that matter. Um, so knowing that we use COVID funds for one mobile vehicle, can you see how much it would cost for one that would be suitable for all the needs that we could use? So if you have two mobile vehicles, you can, whenever we have our festivals, whether you have the Kumba Festival or you do the Friday
After
on
five.
Main, your Friday after 5, people can come and you can bring your kids. You can have a station set up for vaccinations for kids. They're going to need it. And you can go around to the schools for vaccination when it's time for them to get kicked out. There's no reason for you to now miss school because we have a mobile van that can
Yes,
come to your
that's
school
correct.
and vaccinate you. And when it's time for sports, you can have them come out there and they can do physicals. If you have someone who wants to do mammograms, so if you have a space that's available for us, we know sometimes it's hard for our communities to get to us. So we need to go to them. And so I feel like a second mobile unit is not something that we could really argue against when it's a need of our community.
I agree with you wholeheartedly. The cost of the mobile unit that we currently had was $166,000. We paid half up front and then paid the other half. Now, what you're looking at otherwise could probably get a quote for, but I don't know that will be fully funded could be fully funded. I know it will not be funded by that 716. That is
Yeah, that's what, but now my thing is it's a vaccination program. It's for vaccinations, right? So if we're gonna use the mobile unit to give vaccinations, you could use those because that's what you're gonna use it for.
the state says I cannot buy mobile units with that money.
Oh, they tell you can't specifically with mobile unit.
The only one that a mobile unit is available to use would be, that's what we have.
So we got like what? So what we got left for that one?
7.
The 107. Okay.
And
But we can write
it's
for the
taken,
remainder.
yeah, it's taken us 3 years to get this one, and the money has to be spent May 31st.
So it has to be spent and sent to the person by May 31st. And getting the mobile unit is gonna take you at least a year. Right.
Yes.
Yes, me.
You can
or
email,
Jen.
you can email Amanda, that's fine. I
Yeah.
do know that Donna and I also had an idea, thinking about a storage trailer behind our mobile unit, because right now, if we had tables and chairs, we wouldn't want to put them in that unit because the floor is the way, but it's something
But
that.
there's no space for tables and chairs.
Yeah, exactly.
inside
So
of
if there was something we could haul behind it maybe, or somewhere, that we did talk about that as well, but,
I think that is something good for you to come up with and bring back to us to see how much it might cost.
What about supplies that you'll need for the mobile unit?
We were able to purchase that through the regional ARPA funds, like the microscope and lab equipment and stuff for the mobile unit.
Mhm.
We already purchased-
Vaccinations as well, since we're talking about that, vaccination supplies as well. Is it, okay.
I have a question. If the funds need to be spent in the 543, do home test kits fall under that?
We get those free at this time.
anyway.
We have an abundance of them.
Yeah, they come free. I did talk to, I think it was Jana, health educator, about possibly with some of this money, if we could make our own COVID kits like we did before that had the mask and the sets. And then be able to distribute those out to the community because we wouldn't want to just lose the funding. But I think there was hand sanitizer, a small thing of Lysol, a mask, anything else that might be in there that might be beneficial to hand out to the community.
Yes, I think that would be
So,
a good.
and I do know
source
they
for
did
you.
something similar to the churches. Like bags for each church, all the churches in Scotland County at some point in time to distribute. So that's something else we can look at. That's a pretty quick fix.
Yeah.
We
Yes,
can
I
buy
think,
us
and
that
that
kind of
is
stuff.
a useful thing. I do get lots of people who request for like, they still need the wipes and the mask and other things. So I think that, yes, is
Okay.
a good other option to bring back.
I don't think so.
I would have to go back and look there.
Mm-mm.
Can we do what now?
It sounds like a lot of the ideas that we're discussing are fairly small drops in the bucket of
Mhm.
Yes. And
roughly, what, $270,000?
I'm
somewhere
sure
around
we
that.
will never get to that figure between now and the end of May. But I do want to be able to, do want to be able to use the money, as Dr. Singletary said, to where it's needed and not just frivolously where we need, but we do want to use it if it's there for us to be able to use. We have been very fortunate that we've used a lot of it, but there's still a lot of it still left. So any other questions?
You know, I do like the idea of making those kits again and distributing those out because, even at our church, we have a food bank, we have a food pantry where people drive through twice a month. And so not only could you distribute them at a church, but the church could also distribute them through their other programs like a food pantry because, we have a lot of people who come through. And so do the other churches that have food banks. So you would be distributing to the citizens that way too. So that would, and COVID is not going away.
Yeah.
I mean, we have evidence right in this room. COVID is not going away. So people are always needing, and they don't want to spend money because they don't have extra money to spend on hand sanitizer and masks and gloves and that kind of thing. So I think that would be good because we have a lot of churches that could use that and could distribute it to citizens of the county through their own programs at churches.
And if you know of any churches that, I think Jana and Kathy are very helpful when other churches are needing information or needing stuff like that, that they can contact them and we can get them whatever it is that they need within reason. I don't know that I can give a kit to all 33,000 people in Scotland County, but we could make a pretty good dent in it
We could.
with this amount of money.
Mhm.
So if that's the pleasure of the board, then we'll go back and look at that process. That,
Mhm.
okay. Okay. Any other questions? I know I've talked I just want to ask the pleasure of the board for one more thing or two more things. We did have a financial audit from my Department of Public Health 3 months ago. I've not had a financial audit in 6 years. It's supposed to be done every 2 years. I do want to inform the board that we did have two corrective action pieces we had to take care of, but we have fixed those things and we passed our audit.
Good job.
So, did want to give the board that information. Also, with accreditation, I am required once a year to give you 3 different types of financial reports. At this point in time, I give you the financial report every month. There's still 2 more different types of reports that I'm supposed to give to the board. I'm asking the pleasure of the board, what would you look for? Did you want me to find those reports? What more would you like to see on the financial end? It is an accreditation benchmark. That's the only reason I asked that.
I think the only thing, you remember last time we was approving labs
The fee,
And
yeah,
it-
the
the
lab
fees,
fee
okay.
schedule.
for.
That is totally separate. That's a totally
Oh, that's not
separate,
even this, but,
That's a
okay.
that's a total separate accreditation benchmark. I'm sorry.
Oh, you're perfect. Yeah.
That was my question.
That was the only thing.
Yeah.
I mean, you don't have to say tonight. It's just that I just got some ideas of something you might want to see more detailed. Or, I can find something more detailed. I do know Medicaid transformation or Medicaid, the expansion of Medicaid, those kind of things. If you'd like to see numbers on our MCOs, like, I don't want to get in depth about Mary Health and all those people, but if you'd like to say how much Medicaid monies come into our facility via those MCOs, just different ideas that you might have.
If you don't hear anything from us, can you use your judgment to test us out next meeting and
Uh,
see if we can get some feedback?
I
from
do
what
have
about-
one, well, I can test you out next week, next month,
Yeah.
following month, if you'd like,
Mhm.
and see how I think that my mind was automatically drawn to the Medicaid, not Medicaid cost, my Medicaid, MCOs, and how much money I know about those things and how much money they're actually putting into our health department and how Medicaid expansion is going to affect us as well. I think maybe we can get you something on that. Is that good? Any other questions? I'm sorry it took up so much time.
Good. Informative.
Thank you.
All right. We'll now have our monthly summary from our health director.
Inside your packet, there's the activity reports. Anybody had any questions on any of those? Donna, do you want to go over the clinical updates? Or if anybody has any questions for the clinical? And management support, they didn't have any updates there except for our management support supervisor has retired after 30 years. So the next part is the report. I was gonna touch on a few. As far as the renovations, the lab renovations have started. I think they're about halfway done. Is that right? Done about halfway. Hopefully, in a couple of weeks, they'll be completed. And if you have time, just want to stop by to see that. It's really, really nice. I had some staff say it felt like, they went from like the 70s to 2024, so they were excited. Our mobile unit was delivered on February 6th, and the ribbon cutting is next Thursday, the 29th at 2:00. Anyone that can attend, we'd love to have y'all there. As Dr. Singletary mentioned, the mobile unit, it was started before I became health director. The previous health director, Dr. Caldwell, had started it. So he had a different vision of what I kind of vision for the mobile unit. So the back of the mobile unit has interview rooms. And when Donna and I and Tim went to visit, the first thing me and Donna noticed was, oh boy, there's not an exam table. There's not a room in here for exam table. We can't do physicals, which Dr. Singletary brought up a while ago. But I think it's going to be very beneficial to do the immunizations. My WIC director is excited. She says she would like to be able to go out into the community and sign people up for WIC. Use it at the events that we participate in throughout the county as well. So that's the mobile unit. Yeah, in the Christmas parade. Another issue I wanted to talk about was some county issues, was the cyber incident that took place in December. We're still dealing with that right now. On December 22nd, we were informed that there was a cyber incident, and to be proactive, our server was taken down. When the server was taken down, that meant a lot of documents that were on our server, we can still no longer get to. And that kind of put us in a bind as far as our policies and different things like that. We didn't, we still don't have access to Word and Excel. So when Tim and and Donna are trying to do reports that we draw down from the state, it doesn't go well with Google Sheets. It doesn't format right. So I'm working with the county manager on trying to get a license for the Microsoft so that we can draw down those forms that we need from the state. Only about half of our staff, I would say, has access to a computer, so we're having to share. So of course, that's bad on employee morale as well as making it difficult to see a patient. You know, if you've got a provider, if you got a nurse that's triaging the patient and then passing off a laptop to the provider who then has to put their notes in, then the nurse that's doing the triage is having to wait till she gets the laptop back to get the next patient. It's been a difficult challenge. So we're working through that. The last meeting I had with the county manager is hopefully next month. They're gonna scrub the health department computers and try to get us back online. They have developed a computer replacement plan. Health department's computers will not be replaced until I think it's 26, but unless there's something that happens with a computer where it's no longer functioning, then VC3 would look at purchasing another one. But in the meantime, we're not going to get any new computers until 2026 unless something happens. So, you know, employee morale there has been kind of tough, you know, and frustrating trying to get the work done. But I have to say, staff has stepped up to the plate and got it done.
Could we spend any of that money on computers?
The county, we
Like
could.
COVID funds?
We could spend some COVID funds on, but our county manager is discouraging that right now because she said, when you get the new computer, they're trying to work up a replacement plan per county department. So they don't want us getting partial computers. And then VC3 has to put in the security.
Yeah.
So there's a whole thing there. So no,
But could you talk to her about like, so let's, like, for the mobile unit, right? If you're not getting new computers, then you're not gonna get a new laptop that can be in the
Yeah.
mobile unit, right? And you're gonna need laptops for the mobile unit to do multiple things.
True.
So you can talk to her about getting laptops that will be for the mobile unit, and they'll need to have VC3 do everything on those because they're gonna need to be for our mobile unit.
Okay.
And since we have 3 places in the mobile unit that you technically could be taking information, then you would need a minimum of 3, but you would probably need 4 because you're going to have whoever is doing the registration outside in the shelter thing.
And they
So-
could be used in the mobile unit and.
And so
in there.
therefore, once we get them for the mobile unit, when the mobile unit is sitting there parked, they can be used
You could also
as
use them.
needed.
Okay.
Let's wait, get around.
At least that would get extra laptops.
And we got 100, and we have more than enough money to buy some laptops and get them fitted.
Get the fans on and all.
And I mean, you just get them whatever they need. They gonna need a printer for the mobile unit. And if it's not equipped with Wi-Fi, then you're gonna need to get a router and everything that's a hotspot to go with it.
It is equipped for internet. We
And if it's
Tim is
not
checking on getting the SIM card.
card, so
Verizon.
whatever the cost is through the SIMS card, that should come from the COVID money. You can sign a plan that'll give you the the hotspot for 3 years, and then you don't have to worry about it till you have another grant that you're gonna have to pay for the hotspot.
That's a good idea.
Which then would also give you a hotspot for when you go out into the community, that our community could, you know, while they're waiting or whatever, they have a hotspot they may be able to use. You can make it where you set up where it's 2, where 1 with a password. So in VC3 will equip it to make sure it is, you know, cyber protected.
All right. I'll follow up with our county manager on that. I do too. This is budget time with the county, so we, as department heads, we had to submit any capital requests to the county manager so she could forward it to the commissioners. Some things that I have requested, is to add an office in our registration area. We have a lot of wasted space up there. It's very open. And we're short on office space as well as storage space. And so I put in for a new office space there. New carpet in HR administrator office, which we actually were able to get that out of this budget. So Sharon has new carpet in her office as of last week, I think it was. We need to replace at least one animal control truck. Both trucks have, it's approaching 200,000 miles on each, and both of them have been in and out of the shop. And so I've requested to replace at least one of those, and that's about $75,000 to replace it because you're counting the truck and the box to go on the back of the truck. I've asked to reclass our public health nursing director one position from a grade 77 to a grade 80 due to internal equity concerns that exist currently. And I have also requested a new position, public health educator / grant writer. Currently, the grants that we have, I've wrote the majority of them, and Donna and Jana Blue, Jana's here, have helped with some of them. And I think if we had a grant writer on staff, we could get, there's plenty of funding out there for the different initiatives that we're looking at. And so I have requested that position, and they could also serve as a public health educator too, to make sure when we got the grants, that the grants are being promoted out in the public for what the fundings are for. So those are things that, I requested for this next budget year. Waiting to see if it's approved, but that's what I've requested. We have been having issues with the Humane Society. They receive county funding, and they receive funding from the city of Laurinburg. We're supposed to have places to take our animals to when we pick them up. As a health department, as public health, the general statute states that we are responsible for rabies control in the county. If we don't have anywhere to take the animals, we can't very well be setting traps, because if we pick them up, what we're going to do with them. So that's been an ongoing issue for the last few months. I have met with the shelter manager, and so has the county manager. So today I spoke with the county manager again, and she has set up a meeting for March the 11th with me, her, shelter manager, and I think the city manager is going to be there. Someone from the city is going to be there too, because they've had some of the same complaints. There's 30 kennels and for the dogs, and they are always full. So according to general statute, my animal control guys are supposed to be canvassing the county looking for stray animals that don't have a rabies tag. Well, if they find them, they're supposed to bring them in for impound for a minimum of 72 hours while they look for the owner. If the owner is not found, then, they can be adopted, they can be euthanized. It just depends on the situation, how violent is the dog, different things like that. But currently we can't do that because we have nowhere to take them. So that's an issue that we're working on. The county. Any comments on any of that? Okay, staffing issues. We recently sent out a employee morale survey just to kind of get a feel of the employee morale at the health department. Some of the responses as far as the concerns we got back was salary, increased salary, different health insurance, because we currently, county employees have a high deductible health insurance. Bonuses. These are things that, as a health director, I really don't have any control over. I sympathize with them because I'm in the same boat they're in when it comes to health insurance. But things that we can help with is employee recognition, better communication, that type of things with our employees. But I just wanted to make the board aware that we are working on the employee morale and things to improve that morale. IT issues was another thing that has affected the employee morale. Career opportunities, we have hired a part-time HIV case manager. That also comes out of COVID funding. I think it's coming out of 546, the one that's here through December. We've hired, and her name is Jade Oxendine. She started on January 16th. We also hired a new medical biller because the medical biller was promoted up to a different position. Her name is Demetria Pate. She started on January 16th. And we've just hired a part-time temp public health educator that is working on the infant mortality grant with Jana. Her name is Doris Jones, and she just started on the 16th of February. We still have a communicable disease nurse position open. It closed on the 8th, but I think we have reposted it because we didn't have any candidates. A part-time vaccine equity nurse, we're in the process of interviewing for that. Environmental health specialist was reposted and it closes on the 26th. Nutrition 2 position, it's been open for several years now. We've had to repost because we didn't have any qualified candidates. And we're also looking, processing unit supervisor. We made an offer, but the candidate did not accept the offer because of the pay. And so we've reposted that position. Any question?
So when will you post the one? I know like we had the advanced nurse, something from the last.
That's the communicable disease nurse. That's the enhanced role nurse
That's the
position.
inherent. Okay.
Mhm. Yeah, it's been reposted. Any questions? Okay, that's all I have.
All right. Any unfinished business? Anything? All right, we will do our so new business. I think we already we swore in our returning member, Miss Diane Bean, and we welcome our newest member, our engineer, so Ian Yancey. Would you like to introduce or say anything?
No, just glad to serve and be a part of this board with everybody. I think you covered the bases though.
Glad to have you.
All right, we got glad to have you with us. We're gonna recognize some of our former Board of Health members because we know serving on this board is one of service, not really for accolades or tons of appreciation. So we did extend the invitation to some of our previous board members. I do see one here. So we want to tell you thank you for all your years of service, and maybe you'll come back later after you finish with your break. All right.
service on the board, and I know I enjoy, working with you. Real pleasure. And like I said, we have to take a break. For that. So, we thank you. Yeah, so. Oh, yeah, but we thank you, we really hope you.
I hope my time here helped a little the county and that it has been of service of the county government.
I got a quick peek.
Include the podium.
Appreciate you.
Thank you. I wanted to say, we had invited Ms. Bev Hawks, who had been here for 7 years, served for 7 years. Dr. Levy, who served for 10 years. Mr. Matthews, who served for 18 years. Mr. Rayleigh, who served for 20 years. And Dr. Carter, who served for 6 years. Thank all of them for their service.
All right, so we will now move on to department focus. So this month it was on healthy communities, health educator,
That would be me.
Kathy Cox.
Thank you for having me. Good evening. Pardon my voice. I'm sorry. I'm recovering from, and it's affected my voice. But anyway, so I'll just sound gravelly. But I'm Kathy Cox. I've been here 20 years as the public health educator and public information officer. So I've had the pleasure of being a health educator for the hospital formerly. So it's very intense and rewarding position as a health educator. Health educators can work in a variety of settings, public health being one of them, which has been one of my favorites, the hospital setting, school setting, doctor's offices, for insurance agencies, business and industries. I mean, there's just a plethora of areas that public health or health educators can work at. I have a variety of responsibilities. All health educators wear many hats. So we do a lot of different things. My particular position here over the years have included health promotion, which is normally and it is continued, but also being responsible for the community health needs assessment. It's one of the biggest endeavors that my position generally takes care of, along with outreach opportunities, being the liaison between public health and other agencies, serving on other boards where I can take public health information to let them know what we're doing here and how we can collaborate with other agencies as far as working towards our initiatives that we work on. So collaboration is key. So I wanted to go over, really, this has been truly it's a work in progress, but it's really very, very important to me as I am the author, basically, of this particular report. Not alone. I do have a lot of help, and because there are a lot of, and we did place a few of the community health needs assessment reports out for you to take a look at. If you must have one and you'd like to have one, please take it. But if you don't, they are available not only at the library, but online on our website and by request if you'd like. So you're welcome to have it. But the first thing I want to do is if you see, this does say 2022, and you're thinking, why is this just the 2022 Community Health Needs Assessment? Well, it's not due to the state until 2023. So, and that's April. Well, then it takes several months once you turn in your community health needs assessment to the state. They have to review, and it's not just Scotland County, there's regions of public health departments that are turning in their community health needs assessments. So they have to review them and make sure that we meet all of the requirements for accreditation for these. And then they'll finally send our health director a letter of approval, or maybe if there's something that needs to be worked on. And we're so fortunate that so far, knock on wood, we have never had to go back and restructure or redo we have met all of the standards that we are given to support. But as you'll see in the very beginning, that there are acknowledgments that I would like to just shortly talk about, is that all of those who volunteered their time and efforts towards planning and developing and completing this particular report, and special acknowledgement is giving to the Community Health Assessment Core work group that you will be able to see, and also other community members for their time and consideration in analyzing and assessing this data that we got in creating action plans, delineating the focus and direction for our health department and the healthcare system to work towards. So there's a lot of collaboration between the hospital and the health department in putting this, our community health needs assessment reports together, and then afterwards developing our community health improvement plans. So just going through some of the important things. The community health needs assessment is a process by which community members gain an understanding of the health concerns and healthcare systems of our community by identifying and collecting and analyzing and disseminating our information on community assets, our strengths, resources, and needs. And there are four basic steps to this process, which takes it takes a year from start to finish in writing this reporting and turning it in. We first determine the health status of the community. We assess the risk factors that are associated with identified health problems. Then we identify the healthcare resources that are available in our community to promote action directed towards the identified problems. And then we establish health priorities and the appropriate interventions that we need to take on. So every 3 years, local health departments across the state of North Carolina, as I mentioned, are mandated to complete a comprehensive community health needs assessment. And it is a requirement of the consolidated agreement between health departments and the North Carolina Division of Public Health. And the project requires involvement, collaboration for certain, and especially with hospitals. They were required to start completing this project in 2012 when the IRS mandated them to do so. So we, in working towards the beginning of this, we get together, we look at a survey. Have any of you heard about the Community Health Needs Survey? Have you ever filled one out for us? These surveys that we take out, we put them online, we take them out into the public, we take them to churches. We really need people to fill them out. We had a little under 650 surveys that were returned to us, which is a good number, but it's not nearly reflective of our county. And we try to go to all parts of our county so that we can get a good reading of what health concerns are. So we look at primary data, which is qualitative community feedback, and also secondary data, which is data that we actually that are working on this go through statistical data, and then we compare that kind of thing. So the health issues that were determined for this particular go-round, the leading causes of death were heart disease, cancer, homicide and violence, diabetes, drug, alcohol use. The priority health issues were high blood pressure, diabetes, heart disease, obesity, and cancer. The risk factors that were mentioned from from our primary data were lack of physical activity, substance use, again, crime and violence, tobacco, vaping, and poor nutrition. Some of the factors that were affecting families seeking medical treatment were lack of insurance, unable to pay for visits to a doctor, no appointments available when needed, and transportation. Some of the general concerns were economic and unemployment, health insurance, mental health, crime, violence, lack of positive youth activities, and substance misuse. Some of the environmental concerns were safe places to walk and play and healthier food choices. Services and educational opportunities, they talked about mental health, again, positive youth activities, rehab, wellness, pregnancy prevention, dental screenings, smoking cessation, among others. So respondents also indicated that they do support tobacco-free public places and buildings in Scotland County, which leads me to mention to you all that we do hope to come back, even though we have visited the policy, the no smoking policy that's on our grounds and stuff. It has been my lifelong dream as far as being a health educator to bring about county-wide smoke-free policies that would take it to our parks and areas where the public is, so that, so we're hoping to bring that back to you all at a later date for you all to look at. So again, in this report, and I'm not going to go through the whole thing because you all can look at it, it would take me hours. The identified health priorities and areas of opportunity. We looked at obesity and overweight, which includes chronic diseases, hypertension, heart disease, diabetes, and cancer. We looked at mental health, which included substance use and misuse, including tobacco and e-cigarettes, and also positive youth engagement and healthy behaviors. So those were the three main issues that we, as far as our team, our core work group, the Community Health Advisory Board, all came together on several occasions to look at all of the issues that were mentioned and divvy it, cull it down until we could get to the top three we wanted to focus on. And even though there are three, you can see easily that there are a bunch of things underneath if you're talking about, chronic disease issues and all the risk factors that are associated with all of this stuff. So anyway, like I said, this report is very comprehensive. It begins with introducing you to Scotland County. It talks about our geography and history and demographics and our poverty rates and socioeconomics, our employment, unemployment, education attainment, our environment, air quality, transportation, recreation, a lot of data from our sheriff's department and EMS, the police department, highway patrol. We look at our mortality statistics per our county and state. We also compare ourselves to surrounding counties that are like Scotland County. We look at our cancer mortality rates, pregnancies and infant mortality, communicable diseases, minority health and health disparities. So as the report goes on, it will take you through what agencies and individuals in our roles, what those were involved, the health issues and resources that are available. And that's one of the main things that we have to do is look at what resources we have, what resources we need. So that's an important piece of that. And you can go on down to see what our priorities were. I did compare our priorities and resources with what we had from the 2019 Community Health Needs Assessment. Past and present is what that's called. So you can kind of look at a comparison as to what was being focused on today, basically. And then there are appendices included, which includes the survey. Take a look at that survey so you can see. I know a lot of people hate to take surveys. They seem like they're long, they're tedious, and people just don't really have time, nor do they understand the importance. And that's why explaining why this is important to you all is helpful, because you all can help us promote or encourage other people to take the Community Health Assessment Survey so that we get And it also lists our community resources and then references and resources that we used to complete the community health needs assessment. So there are a lot of wonderful pictures in here of things that we have been doing, of other agencies. Again, there's in the appendices, there's all the graphics that will help explain. A lot of people can just look at graphics. You can tell how many people answered a specific question for, say, let's look at mental health, for instance. You know, how many people felt like mental health was an issue, whether in their own family or in the community, and all other issues you can imagine. So that's included in here. So, like I said, I'm very, very proud of this Community Health Needs Assessment Report. And I hope you all will take a moment to look at them. A lot of agencies or people, individuals that are writing grants call us to ask for this because it's already got the statistical data in here that they need. So that's another reason that this report is important. Are there any questions, comments?
I wondered about the surveys. So how do you make the surveys available for completion? Does someone have to be with someone completing it, or can you leave some at different organizations for completion and get them back later, or how does that work?
A little bit of all of it. We do some online. We definitely have to do hard copies.
Mhm.
We'll do some here at the health department. We take it to Parks and Rec. We take it to other agencies. The hospital has them
Mhm.
on hand. Say if patients are sitting in the waiting room, we give them an opportunity to fill out while they're there, and then they just turn it back in. We put boxes out there that they can just turn their surveys in. This is completely anonymous. No names are on there, but there is demographic information questions that we do ask. But we do it online and hard copy. We take it to churches. We have a lot of our community health, the core work group, we're all responsible for taking 25 to 50 hard copies and whatever we can do to take it out to various locations in Scotland County. And then we're responsible for bringing them back. And then we have some of our interns and helpers enter the data into so that they can create the graphs and things, like that. And then as far as writing the report, that's up to, I was the lead here, and then Juanita Swinney Griffith from the hospital, she was responsible for writing theirs. And even though the hospital has their community health needs assessment and the health department has our community health needs assessment report, they're very much alike. And you can understand that their community health improvement plans may differ a little from ours because theirs is from a hospital standpoint and what they're able to do and not do, as well as we from public health standpoint.
Question.
Mhm.
So is there like just a certain time frame that you're collecting surveys, or do you just collect them throughout the year? Or do you say like, well, we're collecting surveys from this time to this time?
We do it in a specific time frame. We usually allow about 3 months.
Okay.
Yeah, it takes us a couple of months as in meeting and getting together and figuring out the most important questions that we need. We look at our past surveys and we always improve them. We take out stuff that we may not need. What we're trying to do is make sure that we're asking the questions that we need to, what are most important for today's time and what's happening today.
So our next one will be in what, 2025?
2025, right. And let me just say, on the interim years from our community health needs assessment, I also am responsible for writing a SOCH. That is an acronym that says State of the County Health Report. And that is just updating of what our community improvement plans, our community health improvement plans, which are called CHIPS, the updates to that. So, this time next year, we'll definitely be presenting a SOCH to you all to talk about you know, the improvements in what we've done as far as, say, the youth mental health. We've already begun doing some of that this year in 2023. This is 2024. In 2023, we began working on some of those initiatives. And so those are already put in. And like I said, there's computer programs I can't get into right now that where we go in and put all of the things that we are doing so that when we do write a SOX report, we can do that and y'all can see that, and we can definitely share that with you when the time comes. This again, the SOX has to be turned into the state. They do send us back a letter of approval signed, which we all I hop up and down when I know they have approved our reports, because it is such a relief, because it is a huge endeavor. But I appreciate your time. I hope I'm a chatty Cathy. I talk way too much. So if there are no questions, please, if you all would like a hard copy of it, let me know, or I can shoot you off to our website or send you one via email, that kind of thing, so that you can take it and you look at it for yourself in more depth if you'd like. Okay. Thank you very much.
Just a question for Amanda. So, the community health assessment, I know, it's like our time to renew our strategic plan for, so we'll use this with the swatch and our other ones. And Kathy's on the
Mhm.
strategic plan.
Yeah, all of the senior management team is on there.
Community health needs assessment is definitely used when we are working on our strategic plan.
All right. Thank you.
Being new to the board, what statistically our county compared to our neighbors or statistically comparable counties, where do we stand out, or where are our points of concern? I know I'm going to go home and read and study it, but just kind of an overview, 30 seconds. I mean,
Well,
That's a loaded question, actually.
I can give you like some brief overview as a board member. So, Scotland County is one of the poorer counties in our state. And so we actually have lots of areas of need. So when you read this report, as when I was going through it, you will notice that our numbers where you would expect for them to be, you want to be lower than the state. We are higher than the state average. And things where you want to be lower, like we're the opposite of where you want to be. Pretty much all areas when it comes to teen pregnancy, poverty rate, graduation rates, literacy rates, anyone you pick, we are not where we need to be, which is why when we talk about the funding that's not used, we are so adamant that there should, in a county that is behind on all health aspects, there should never be money not used for the health of a county that's in need. Like one of the biggest things also had to add like HIV educators, because we have some of the highest numbers for new HIV cases. Like we have more cases than we have people that can help.
Infant mortality rate is extremely high. So therefore, the grant for infant mortality. So that's why I have requested, a grant writer to work on some of these issues. Seek funding for the initiatives.
When you read your report, you will be able to look at some of the comparisons and see where we are ranked. And the county health rankings will come out. That is a sore subject with a lot of law and guardians. They don't like hearing where Scotland County falls in the health rankings, and so, but it does. This report will share with you, because again, it compares all the counties as far as mortality statistics, just about, everything. It's, like I said, it's pretty comprehensive. And anytime you have any questions, please feel free to call me. When you call the direct number to the health department,
wait for it to say health education. I'm not sure what number that is. But the health education department, and I'll generally answer, Jana or I will answer. And if you want to ask me specific questions, I'll be glad to help. That's another thing a health educator is somebody who's a resource for the community.
Thank you.
Any other questions? Comments from anybody?
I just hope that with all the numbers that you were, throwing out and alluding to, that the new mobile unit will help us to move to the other side of that and be more positive. Because one thing I found with the pandemic is that we have to be creative in our outreach. You can't wait for the people to come to you for the services. You have to take the services where the people are. And I think we're on the move to making that happen. So kudos to everybody.
And I think, transportation is a big
Yes, it
barrier
is.
to
It
the people we
is.
serve. So getting out in the community, we're really, really excited about that.
Absolutely.
And I think with that mobile unit being visual,
Yes.
when it's visual,
Yes.
people don't really have an excuse to not, hey, they're right here.
That's right.
I might as well go ahead and do it when it's before. If you have to think about it and try to get somewhere, they may think twice and not do it. But
Right.
if we're right there with it and have something available that's easily accessible, I think that more people will participate and benefit from the services that we'll be able to provide.
I agree.
Yes. All right. We thank you for that. And moving on, we have some approval for new funding. I'm gonna let.
Yeah,
What-
we received a additional $24,299 dollars with the reducing infant mortality grant. That was in addition to what we have received previously. And so we need the board's approval on the new funding.
Okay.
I make a motion that we approve the $24,299 for the additional funding for the reducing infant mortality grant.
I second it.
All those in favor?
Aye.
Opposed? None. So it is approved. The funding, additional funding for the reducing infant mortality grant. We'll move on for required training for the board and tour of the health department.
Yes, inside your packet, I put the sheet that has the website that you can go to for the board training. And for the ones that haven't completed the training, once you complete it and get your certificates, there's like 6 of them. If you would get those to me, Miss Stephanie gave me hers tonight. Get those to me so we can put them in the file for accreditation, because that is an accreditation benchmark. And if anyone would like to take a tour of the health department, just reach out to me and we can make that happen. Mr. Yancey came a few weeks ago and went on a tour, and we're very happy to show off our recently renovated general clinic. And as soon as the lab renovations are done, we're really proud of the work that's been done with the COVID funding. Our general clinic was completed first, and that's the clinic where we use to give COVID vaccines. And it really needed updating in it. We got new flooring, new exam table, new cabinets, new lighting, and the same things occurring in our labs. So we're really excited about that. So anyone that is interested in touring, just let me know. We're glad to have you.
So any additional discussion from anyone? Anything kind of cross your mind, maybe input for Tim for spending that came while we were talking? No? All right. So our meeting is adjourned at 7:10. And we will have our next meeting in April.